Hi everyone. In this video I am going to discuss about shock. So what is shock? Basically shock is a life-threatening medical condition which is characterized by inadequate blood flow and oxygenation to body tissues which leads organ dysfunction and failure. So it's a medical emergency that require prompt recognition and treatment. Okay, after that I am going to discuss also the types of shock. So the types of shock are several types which are classified based on their underlying causes and physiologic mechanism. So type 1 is cardiogenic shock. So cardiogenic shock results from heart's inability to pump enough blood to meet the body's needs, often due to myocardial infarction, heart attack or heart failure and arrhythmias. So simply it's a damage to heart affecting blood flow to the organs. So the signs and symptoms related to cardiogenic shock are chest pain, there is severe chest pain, also abdominal, arm and jaw pain, sweating all the time and also cold and sweaty skin and shortness of breath. And causes of this shock is heart failure, myocardial infarction and arrhythmias. So this is all about cardiogenic shock. Then there is other shock which is hypovolemic shock. Hypovolemic shock caused by significant blood or fluid loss leading to decreased blood volume and perfusion. Basically, the symptoms of hypovolemic shock is tachycardia, hypotension, confusion, high respiratory rate, and it may lead to an LOC. And the causes of hypovolemic shock are trauma, bleeding, surgery, burns, dehydration, and vomiting. These all causes cause hypovolemic shock. Okay, and there is another type of shock which is septic shock. So septic shock is caused by severe infection which leads to widespread vasodilation and organ failure, and also it leads to systemic inflammation and decreased perfusion. So the symptoms of distributive or septic shock is confusion, clammy skin, high and low temperature, nausea and vomiting, hypotension, tachycardia and shortness of breath. The causes of this shock is bacteria and virus. Septic shock typically follows sepsis. Okay, so this is all about septic shock. Then another type of shock is neurogenic shock. Also this is known as distributive shock. So disturbance to the autonomic nerve system which results in vasodilation. So after vasodilation there is decreased perfusion of blood to the body. So the symptoms of neurogenic shock are loss of reflexes, blow injury, hypothermia, bradycardia, discolored extremities and hypotension. The causes of neurogenic shock are spinal cord injury and trauma and brain injury. So this is all about neurogenic shock. And then there is anaphylactic shock. Anaphylactic shock is a severe allergic reaction which causes vasodilation, bronchospasm and decreased perfusion. Okay, and it is also distributive shock which allergic response which cause widespread vasodilation. So the symptoms of anaphylactic shock are skin reaction, breathing difficulties, confusion, dizziness and fainting, also nausea, vomiting and angioedema. Angioedema, simply swelling of blood vessels, is called angioedema. And the causes of this anaphylactic shock are allergen, for example nuts, medication, insects bite, food, latex. So this is all about anaphylactic shock. And then there is obstructive shock. What is obstructive shock? It is caused by physical obstruction of blood flow such as an pulmonary embolism or cardiac tamponades. So Obstructive shock is blockage to the blood vessels in the heart, which cause decreased blood perfusion to the body organs. So the symptoms of obstructive shock are cyanosis, which is the bluish discoloration of skins, which caused due to impaired blood perfusion and have little amount of oxygen. That's why there is increased level of carbon dioxide. That's why there is skin color bluish. We call it cyanosis. And then there is high respiratory rate, tachycardia, and may lead to LOC. So the causes of this obstructive shock are tension pneumothorax, pulmonary embolism, and cardiac tamponade. So this is all about obstructive shock. Then these are all the types of shock which I discuss in this video. I hope you will get more knowledge about shock. Thanks for watching. Bye bye. Allah Hafiz.